Today we are talking about evidence-based education series, the series 2, and the topic is focus question. And I am the presenter, Bharat Modi. PICO is the method by which we do the focus questioning, and questioning is something which we need to do in day-to-day life every day, because unless you answer those questions, you will not be able to practice evidence-based. Evidence-based, as we have already know, is consent as explicit and judicious in nature, and it is related to patient concerns, best research evidence and clinical expertise, and that what is evidence-based education, and we have to keep that into consideration. Now, what is the evidence-based process? It contains monitoring and surveillance of health and diseases, identifying causes, the diagnosis, prevention, and treatment. So there are 4 categories which we are talking of: diagnosis, prevention, the therapy, and prognosis. Every patient who comes with you, we are always in dilemma what is to be done, and that is why we need to go and do research. So what is to be researched and where it is to be researched is the question for which this program is there. Cigarette smoking is a cause of periodontitis. Why is it not everyone who smokes develop periodontitis? Why do only non-smokers also develop periodontitis? These are the kind of questions which we need to ask ourselves. We don't accept things blindly that cigarette smoking causes periodontitis. We have to evaluate what is the percentage of people who develop periodontitis because of smoking and what who don't. Similarly, there is acute ulcerative gingivitis and metronidazole, the choice of treatment, which we have been doing traditionally for long, but there are some people who recover even without giving metronidazole. So you need to know how much, what is the percentage. So you have to locate your information, evaluate the information, and use it effectively. That is what is called as information literacy. So you need to recognize what you, when and where you need the information, and this is generally at a point of care when you are trying to treat the patient. That is the time when you need your information. So you have to have the ability to locate it, evaluate, and use it effectively. Now, information, when it is required, we need to do this to do the right thing. That is why we need information. There is a need for healthcare and finite, and the resources are only finite. We don't have unlimited resources. New data keeps on coming every day because of new research taking place, and patient expectations about healthcare is increasing because they are also going on the internet and getting information on their own, and that is why you need to have information. Now there are more than 90 new articles coming per day, and critical appraisal if you have to do, then and if you are spending 2 hours per day, that means 38 hours per day you need to spend, which is impossible. So what you need to do is to go for evidence-based system. So let us see how it works. There are 5 A's which is there: converting your clinical information into answerable questions, using databases to find, that is ask, critically appraising the evidence, that is appraising, integrating the appraisal in the form of applying, and applying the results and to assess whether what you have done is correctly done or you have not done it correctly. This is the 5 A's of your evidence-based system, and those need to be followed. The first step in the quest of clinical question is formulating of a clear and focused question, which is the topic for today, and converting this, the need for information about prognosis, diagnosis, prevention, and etiology. That is the categories of information which you need in evidence-based practice. So normally what you would do is ask someone, consult a book, find a relevant article, or use a bibliographic database. Now there is the hierarchy of evidence which is there. Asking someone or consulting a book may not be the right thing, but for that you need to have a focus question, and you have to know how to frame a focus question so that you can get the right information. Now there are, as I said, there are categories of clinical question which is there. One is the question of etiology, identifying association, risk factors and causes of disease. Diagnostics, selecting the tests and accurately detect the disease. Therapy and prevention, select the method of intervention and how to prevent it. Prognosis is predicting the probable outcome of that disease. This is a normal process which we do in our day-to-day practice, and that is why we need it. For example, in etiology, are teenagers who frequently drink soda compared to those who don't at risk for developing dental caries? So this is a cause and effect kind of a thing, and then the risk which is there, where that is to be found. So identifying association, risk factors and causes of the disease is what terms is of etiology, and that we do it day in and day out. The second is on diagnosis. In patients with undiagnosed oral lesions, can a toluidine blue mouth ring compared to an oral biopsy affect the oral cancer and precancer? So that is a test selection. What kind of a test should you go for? What is the kind of test which the patient needs? In therapy for children with posterior crossbite in primary dentition, will occlusal grinding to remove the premature contact when compared to other intervention or no intervention prevent posterior crossbite? Now this is selecting the effectiveness and efficiency of a therapy is to be decided. The other part is the prognosis which is there. For a patient with osteogenesis, will smoking cause the failure of the implant? So predicting the probable outcome of a disease, whether it is on the positive side or in the negative side, that is what is required, and that is where evidence-based education will help. So you have different research design for different questions. For etiology, randomized control trials, cohort, case control and cross-sectional. In diagnosis, we have comparisons which are done with sensitivity and specificity. In therapy, we have again randomized control trial, which is the ideal one. So for searching, what do you need? You need to have a focus question. You have the PICO principle for the search item. You have to go get alternate item, that is the mesh term, and then you have to limit this query, because when you query on your search engine, you will get thousands of articles. So you have to limit that to nearly 20, and that is what is evidence-based going to do. So developing a focus question, the important thing is to stop questioning. Curiosity has its own, not to stop questioning. Let us have an example now. Your morning patient, Mrs. Tyagi, is distressed because she has read an article that amalgams causes mercury fumes. So she is worried about that, but she doesn't want to replace her teeth if it is not necessary. So, and she needs proof for herself as well as for her children, who also have several fillings. The first step is identify the patient problem, or that is the first part of PICO, that is the P. The primary problem, patient's main concern, disease of the health, age, all these are part and parcel of the P. The P phrase would be as detailed as you can, and all the characters should be there. But in our patient, we are not interested in the age and sex, because it is throughout it is the same. So for a patient with multiple silver fillings will be the phrase for the first part of the PICO, that is the patient characteristic, and that is what you should be able to write in your focus question. The second is the intervention. She doesn't want a replacement. The main concern is that can we leave the filling together as it is. So for a patient with amalgam restoration, will leaving the amalgam restoration intact. That is the second part of your PICO, that is the I, that is intervention. Then comes your comparison. With what are we trying to compare? So she does not want replacement. So in compared to replacement would be your comparison. So compared to replacing the restoration would be the third part of your PICO question, that is the C part of the PICO. So whether it is a crown or composite or whatever other treatment is there, that we are not concerned with. Outcome should be the patient main concern is that she should healthy and the mercury fumes should not be so result in no adverse general oral health condition, and the amalgam will remain safe for a long period of time. So that is the O or the outcome part. So all these four PICO constitutes the PICO. So if you want to summarize for your patient from you started off with a patient summary as a case example, and now we are doing a focus question for a patient with amalgam restoration. We leaving the amalgamation intact as compared to replacing them result in no adverse reaction. So that is your question which has come. Another question is 57-year-old patient having adult periodontitis with 5 millimeters of pocket depth. Would only scaling and root planning will be enough, or should we give some antimicrobial therapy also along with that? So that is the question or the summary of the patient which we are looking at. With patient with periodontitis, whether only scaling is to be. So when you go for the PICO, you find that is a patient with adult periodontitis more than 5 millimeters of pocket depth. So that identifies the patient. Then you want to do scaling as well as minocycline has to be given, and for that the question would be for a patient with adult periodontitis and localized periodontitis of more than 5 millimeters, will using SRP with minocycline as compared to SRP alone result in greater reduction of pocket depth and disease progression will be limited. This is how focus questions are to be there. Another example is of patient Ajit Shetty, who find that there is discoloration and he wants to look younger, and but he is a coffee drinker and is a smoker, which is what the stains are there. When you examine, you can see that stains could be removed by scaling, but at the same time that discoloration needs to have bleaching, and so you are trying to go for home bleaching. Now, bleaching procedures are related, and the related fees which are there are to be told to the patient. So you have two categories. One is the laser bleaching, and there is a whitening paste. One is in-house, and the other is over-the-counter medicine which is there. So you have to give the patient the pros and cons of it. So when you do this, you will go for the P of the PICO first. The level of the disease station, the age, gender, previous condition, past current medication, all this will be constitute the patient population or the P part of the PICO. The chief complaint there is the discoloration of teeth, and he has tobacco and coffee drinker, heavy. So age and habit of the previous behaviors may influence the disease also. So what is the treatment approach? So identifying the intervention is the next step. It may include diagnostic treatment, adjunctive medications, or whatever. So in our case, it is the intervention being considered is the whitening paste, which is the over the counter. The comparison, on the other hand, in our patient is a custom tray selection with home bleaching as the main alternative towards what is to be done in-house. So you are comparing the in-house part, and you are comparing the over-the-counter where the patient can do it himself in his own house. So and then you want to know the income. The income is the bleaching. Can it be done within 1 week? That was the first question which Mr. Ajit Shetty asked, and that is the most important part, whether it can be done within 1 week's time of getting his teeth bleached. And that is the PICO which you develop, which is called as the focus question. And the focus question is what will help you in searching. So structuring the PICO question, which is a P for a patient with tooth due to coffee and tobacco, that will be the first part of your P for Mr. Ajit Shetty, your patient who has come for discolored teeth. And then you have to go for your other part of your PICO question and complete your entire focus question. The intervention which you are trying to do is the whitening paste for a patient with tooth decay due to coffee. Will whitening paste done in-house or done professionally? And then you have to go for the comparison. So comparison means for a patient with tooth discoloration due to coffee and tobacco, will whitening paste as compared to custom tray for use with a commercial at-home whitening bleaching system use? What you are trying to as compared to, so you are trying to get the outcome. So he wants to get it within 1 week's period of time. So the entire your focus question is then developed, be effective in whitening the teeth within 1 week, and that is what the focus question can be developed, which can be then utilized for searching. Now here when you want to search, you have to go for key items. So you have tooth bleaching, tooth whitening, whitening paste, whitening strips, hydrogen peroxide, carbon monoxide. Now when are you searching for on the internet or in the search engine, there may be the same thing can be in different, so you need to have a strategy. The strategy will tell you what is to be. So you break it down into that PICO system which is there and make it concise. Once you make it concise, the next question which you would ask is what is the kind of treatment which you want to do it. So discoloration due to coffee and tobacco, will whitening paste be as compared to, that is the kind of question which focus question. Then what is this type of question, whether it is etiology, what is the category of it. Then what is the type of study which you are looking for. According to the pyramid, evidence-based pyramid, case series and case reports and editors, letters may not be important. You might have to go for randomized control trial. Once you have done that, then alternative terms for the PICO terms which are, as I already told you, whitening paste, tooth whitening, whitening strips, tooth bleaching, custom tray, all these are different things. List your inclusion criteria, whether it is gender, age, year of publication, the language in which you want to, and what, whether it is latest and whether it is on human subject. This list you want to, the irrelevant factors which you don't know. For example, whitening dentifrice, whitening toothpaste and whitening mouthwash are not under consideration. So those should not be included. So that should be in fact positively excluded. And then you go for your searching. So focus question exercises we need to do so that we understand this thing much better. How effective are occlusal splints? Now these are the questions which you want to know, but that should be converted into a better focus question. Are canine guided occlusal splints more effective than non-occluding splints in reducing temporomandibular joint function? Chlorhexidine is good for gingivitis. Using chlorhexidine twice a day, will it be better to reduce severity? Similarly, question on diagnosis, transillumination will detect it much better than bite-wing radiography. So your simple questions have to become more elaborate. Does daily patient flossing reduce the incidence of periodontite? So similarly, you have different, whether it is behavioral technique or whether it is actual intervention which you are going to do, whether it is diagnostic in conjunction. You have to be elaborate, you have to have a comparison, you have to have an intervention. Once you have that, this detailing will be make it easier for you to search. So PICO and the search is the next part which we will take into consideration. So let us take the clinical scenario in which we will need the PICO question. 10-year-old boy have an appointment with you for treatment. You have treated the patient and the father asks, "Doctor, we see a lot of ads about sugar-free chewing gum. Are they good for my children?" Now this is the summary of what the patient wants to know, whether chewing gum has to be used. So you convert that into PICO. Do children with deciduous teeth, because that identifies which teeth it is there. It is not for permanent teeth, it is deciduous. Who consume xylitol or chewing gum, which is your intervention, compared to those who don't, have lower incidence of dental. So you have the population PICO well in place. So what is the patient preference? Children of adults, children or young adults. What is the sugar free? That is xylitol and sorbitol. What is the comparison? Not using it, no fluoride also. And what is the meaning of good? Always whenever outcomes are there, they have to be specific. Good, bad and all this will not take, should not be used. So incidence, the caries index, the DMF index is what will tell you which is better. The second scenario which we want to take into consideration is a company representative comes to your clinic and powering toothbrush and says it is better. This is the kind of situation which arises in our clinics day in and day out. Medical representatives will keep on giving outlandish results for their products. So we have to evaluate whether that product is good enough. So for adult patient, will the use of powered toothbrush compared to a manual toothbrush result in the reduction of plaque and gingivitis? Now this is your PICO which is there, where the patient population is adult patients, intervention is a powered, and this is the framework which you have to utilize. This is the template so for your PICO. Once you have this template and you write, then you have also the alternatives or synonyms which are present in this condition. So for a 72-year-old patient with osteoarthritis, where COX-2 inhibitor compared to regular NSAID reduce that. So if you want to translate that, so you can do it in that PICO SAM, and in the outcome, reduced gastric and economical are two different parts. So they should be considered separately, and that is how you have to develop your PICO. A 70-year-old man is concerned about the bad breath which is there, and is skeptical because you say that home brushing will be enough. So again you develop your PICO in that, identifying the patient, what is the intervention which you get, that is education, comparison, that is a comparison with don't do anything, no intervention, and outcome is whether it improves his health or not. So here what we are going to do is getting alternatives also. Bad breath is also known as halitosis. Toothbrushing also can be related to oral hygiene. So does toothbrushing in comparison with doing nothing, which is decrease bad breath in older male patients, is the kind of focus question which you have to do with the alternatives of halitosis. Because when you are searching, it is not only the PICO which is there, we have to go for alternatives, otherwise your search will be very limited. So will adult patient with sleep bruxism find an occlusal print reduces jaw and muscle discomfort? You break that into the PICO. Adult and sleep bruxism and occlusal sprint. Now these are the keywords which are there. From the PICO, you are now going into keywords. Adult, sleep bruxism, occlusal sprint and pain, because these are the words which will go into the search engine for your searching purposes. So after doing the PICO, first you started off with your case summary, then you have gone into PICO. From the PICO you are going into specific keywords which are there. Different examples are there here, preschool, whether to use fluoridated toothpaste or not, especially in areas where fluoridation is there. And that is where we come into what is called as the mesh equivalent. So alternatives which are there, each search engine will have a different methodology. For PubMed, we are using mesh, and PubMed is the most, that is why I am focusing only on that. But Ovid has its own, EBSCO has its own. So you have to use, depending on the search engine you have to use. So you have toothpaste, you have dentifrices, you have fluoride, caries, dental caries, even decay can be is a mesh word, and you need to use all that. So if you have just putting in toothpaste, you get 2000 articles. But when you put toothpaste as a mesh article, you get 1700. When you combine that 1 and 2 and 3 and 4, you get more than 400. So you remember that when you combine the searches, you get more articles. Otherwise, there will be limits. Now, getting 4000 results is good, but then you can't read all of them. So you need to break it down. So you have to give limits. Okay, what is the kind of question it is there? Whether it is therapy or what. Then what kind of study design are you looking for? So limit it to systemic reviews or randomized control trial. And what do you what is the outcome which you need to do that? That you specify. Then you find out the alternatives to compare the so when you combine this, you will get only specific to that particular part instead of getting everything on both the interventions. You will get the combination only. So that is how you have to improve it. Pico worksheets are available online. You can easily download that and you can use it, and it really easily tells you how to go about it. Once you have this template, and when you keep on writing down the answers to each one of that, you will develop that habit. As you can see, you are all the problem, the question and the framing of that is all given into in that particular template. So it tells you about the sex, age, publication types and all. So all that limits which you want to create, all this is present in the template. So once you have written the template, the next is you type out the question and circle one of the categories of that. So that is to be added. Then what are the type of studies? Meta-analysis, systemic reviews. So you circle that. Then you list the main topics which are there, which you would use to search, and that is how you develop the focus question. For example, in this you have children, school-based fluoride varnish. The comparison is not there. So the mesh term for children will be anybody from 0 to 18 years. That will be the limit. Then varnish program, topical fluoride can be another, and residual incidence is dental caries. You have to go for the DMF index for that. Now let us go for some other exercises which you can do it at home in adult patients with moderate periodontitis and HB1AC, HbA1c at more than 12. How much effect will be on the periodontal cell. So you break that into a PICO statement, and then though I have given you the answer, you can hide this answer and then you can practice at home. Similarly, periodic survey is planned for oral cancer. What is the screening test which you have? So you should know what is screening test and what is confirmatory test, and you have to limit only to those which can be utilized in the field, where you can go to the field and do this screening test and then go for confirmatory. In patients who have got injuries, especially young children, then intracranial injury is very difficult to find out. So you want to know how good is your clinical examination good enough to evaluate whether the patient has a risk of intracranial injury or not, and for that you want to go for the neurological signs and symptoms which are there, and you want to compare them. So this is a question of diagnosis which is there, and the methodology which you would use is a control study, systemic review. Secondary articles will be much better, systemic reviews and meta-analysis. So among children with head injury, does the use of CT scan versus the use of clinical findings affect identification and diagnosis of intracranial hemorrhage? Now, this is the kind of PICO which you develop, and then from that, when you start, the question is about and another question like this is mothers who have consumed cocaine, will there be a problem as far as the child is concerned, the development of the child? So again you develop including the type of study which is to be taken into that. For this kind of question, cohort studies would be best. So you take on. Every subject can be converted into a PICO question. For every subject there are a whole lot of things, and whatever subject you are in, if you keep on practicing, you will get the PICO question. So the search strategy will be the next part of my presentation. Mrs. Tyagi and her daughters are going for a wedding, and she wants to look at her best, so she wants to go for bleaching. She has got tetracycline staining from antibiotics which are tried. Now the question is whether tetracycline staining will be removed by the chairside zoom staining as compared to what is available over the market, white strips which are there. Will that improve, or whether she has to go for in-house professional chairside, because these are